Hey, good afternoon. Thank you for joining us. This is the second of our community conversations. We're going to have 3 this month. This is number 2. I'm Dr. Kristen Francis. I'm a child and adolescent inpatient psychiatrist here at Huntsman Mental Health Institute. And I have with me a great group of panelists today. And we can talk about questions that are relevant and really important right now. How to get help for your young people, the teens in your life, the kids in your life. So this is Mental Health Awareness Month, which is really a nice opportunity for us to come together. We can share experiences. We can talk about patient care. Today, we are going to talk about children and teens and how to navigate this really complex system for many, how to get your kids help. Just to go over a couple statistics that highlight the importance of this topic right now. 75% of mental health disorders have an onset between ages 10 to 24. So 75%, 3/4 of all of the diagnosed mental health conditions are between those ages. And during the COVID pandemic, we have seen unprecedented levels of mental health needs. Unfortunately, suicide is now the leading cause of death in Utah for children 10 to 24. It is second in the nation, but in Utah, it's our number 1 cause, which is significant. And that more than 140,000 children in the United States have lost a primary or secondary caregiver during COVID. So there are a lot of young people in need of support. Also, mental health disorders are the number 1 source of disability worldwide. So that's more than heart disease or cancer. In a lot of cases, young people will hide their suffering from their families, and really they don't need to. And that's one reason we're here today. It's really important that caregivers and families know how to support their young people. So I'd like to start off and introduce our panelists. We have, starting at the end, Dr. Amanda Miller. We have Dr. Wilson Barlow and Radha Moldover. Welcome. Thank you. Thank you for joining us today. Would you please introduce yourselves and give us a little bit about your background? We'll start with you, Dr. Miller.
Okay, sure. I'm going to take this off for a second so you can see who you're talking to. I'm Dr. Amanda Miller. I'm a trained clinical psychologist. I have been at uni, now HMHI, for over 20 years and have worked predominantly with youth. Most of my time here has also been in our day treatment programs, which is an intermediate service between outpatient and inpatient, where kids are here about 4 to 6 weeks and they're getting intensive care and doing some schoolwork while they're here. And I think a lot of the public actually is not aware of this program, this service, which can be really helpful for kids who've been struggling. My role here is I'm the intermediate services director over youth, our youth program, some of our youth programs, and that is includes our 2 adolescent day treatment programs, Teen Scope and Teen Scope South, our little kid day treatment program, Kid Star, and then we also have an adolescent residential.
Thank you, Dr. Miller. Welcome.
Thanks. It's nice to be here.
And Dr. Barlow Wilson.
Yes. And again, thank everybody for their participation and willingness to take time out of their day to learn a little bit more about this very important topic. I am a licensed clinical psychologist. I have been here at Huntsman Mental Health for about 5.5 years. I've been fortunate enough to be able to work across a wide variety of our programs and different units, including child, teens, adults, inpatient programs, outpatient programs, psychological testing for diagnostic clarification purposes, as well as more recently doing a little bit more with the integration between mental health and physical health needs across our hospital system.
Oh, thank you, Dr. Wilson Barlow. Welcome. And Radha, welcome.
Thanks. It's nice to be here. Thanks for asking me to be here. I'll also show you my face so you know who you're speaking to. My name is Radha Moldover. I am a licensed clinical social worker, and I've been working with our organization, formerly UNI, now Huntsman Mental Health Institute, for almost probably about 15 to 18 years. I can't remember. I had a little break in between. But a long time. It's been a wonderful place to work for me. And I have also had experience across our levels of care. I've worked on the inpatient adult units as well as the child and adolescent units. I've worked in day treatment for most of the time that I've been here. And I've also been working with outpatient services for a group that we hold for kids in the outpatient clinic downtown. And my day-to-day is managing the Teen Scope South program. We have expanded our day treatment programs into the community. So we find that a lot of our families are coming from the southern part of the valley, and we're more accessible. We're right off the highway, which is actually makes us accessible to people from all over the region. But we've found that we've been able to serve more of the families who are seeking our services from the outpatient level of care. So families who've been having their children go to providers in the community, psychiatrists or psychologists or therapists once a week to do a session, and finding that that's really not enough care for those children, needing a higher level of care, sometimes because their children won't go to those outpatient appointments, right? So sometimes kids are so debilitated that they're really not able to even do something like going to see a provider on a weekly basis. And so our programs are there to help families in those situations and in others. But the program that I manage, we're looking at a really comprehensive assessment of the patients who come to us. Oftentimes, it's not clear what is happening. Families are unclear what's happening. Providers are unclear what's happening and what's needed. And so we have an interdisciplinary team that we work with. We have psychologists, we have social workers, we have psychiatrists, we have a teacher who does an educational program in our program. And we're looking at the child from 360 degrees, where we have them there for the whole day. So we're really able to see how they interact socially, how they interact with their academic responsibilities, how do they interact in less structured activities like lunchtime. And it really ends up looking like it's almost like a laboratory for us. We can kind of like observe people and see how they are in a type of naturalistic environment, and that gives us a lot of information. And so then we're able to collaborate as a team, make a treatment plan, and we have our patients there for 4 to 6 weeks. So it really gives us an opportunity to do a lot of intensive work with them, and then refer to the providers who are in the community to continue the work. But at a point where that child is more stabilized, they're able to attend school, they're able to go out and see their friends again, they're able to do the things that they need to do to function, and their family has the support and has the kind of education that they need to keep their child safe outside of a hospital environment. And really we're there to prevent a hospitalization. Kids who don't need to go to the hospital yet, we're hoping will come to us so they won't have to go to the hospital. And it's an increase from outpatient level of care that can really help kids get through a crisis and families get through a crisis and get back into living normally again. So,
thanks, Radha. So if you're just joining us, this is the second of 3 community conversations, and we have a great diverse panel here today to answer the kind of relevant questions of how to help your youth access and navigate this somewhat seemingly complicated medical system. We're here to distill it down and make it easier for you. And so this is a nice example of the different clinicians we have here at Huntsman. So we have psychologists who can do lots of assessment and individualized therapy. We have an LCSW licensed social work counselor who can do therapy and do any type of diagnostic, clarification as well. I'm a child psychiatrist. I'm an inpatient medical doctor who works with children, can prescribe medications if needed. We all do different levels of care. We have some day treatment, outpatient, inpatient care. So we're all kind of the providers that you would normally see if your child came in. So let's get started with some of our questions. Dr. Miller, if you would answer, we're going to start off with what signs and symptoms would you think that we would want to look for to know if a child is suffering from a mental health condition?
Yeah. You know, I think, there's a number of things, and obviously it's unique to each child. But I think social isolation is a big one. I think avoidance of school or a decline in grades is a big one. I think maybe a pretty significant change in behavior. And that could be, acting out behavior. It could be doing things they didn't normally do that could be sort of more risk-taking or more angry, or maybe they're starting to get into substances. I think, obvious if you're seeing self-harm on them, or if they've made comments or passive comments about suicide, or just like, I don't really want to be here, kind of things like that. What else? I think, sleep disturbance, sleep changes in sleep, really like not eating, loss of appetite.
Sometimes eating too much.
Yeah.
Maybe changes, just general changes in appetite.
Yeah.
Yeah.
Yeah. And any, kind of significant changes in their friend group too. Not always. I mean, that can happen, it's hard to be a teen, right?
Totally. So it sounds like we're looking for differences in their everyday functioning and like
Yeah.
multiple different areas. So not just like only with you and kind of talking back, but in general, not doing as well at school, at home, maybe with friends, that kind of stuff.
Yeah. And like if they're not interested in things they would normally like to do, they just don't seem to have the energy or motivation to do things that they previously really loved. Yeah, those are things too.
Thank you.
Sure.
Would anyone else like to answer? Oh, Dr. Wilson Barlow.
Sure. Yeah, I will just add to that. If a child or a teen starts to worry more, starts to think about, big picture things that are maybe beyond their age range, and a variety of those topics, that could be another important signal, as well as dropping activities, quitting sports teams, or Girl Scouts or Boy Scouts or something along those lines. Some of that, of course, is normal, but if it seems like abrupt or maybe an avoidance tactic, that would be a little bit more concerning.
Okay, great. Good. Anything you'd like to add?
Yeah, I think it's important to know too that depression is often thought of as that children are going to look sad more often, that they'll look, they'll have a depressed mood, that they'll be crying often. And an important difference that is often present for kids is that they're irritable more. So they're more easily annoyed, or they're more sensitive emotionally. They might be snapping more, or just not able to manage their anger and irritation as well. And that sometimes gets mistaken as, kind of teenage moodiness. And sometimes that's what it is. And sometimes in combination with the other symptoms and behaviors and presentations that Dr. Mill and Dr. Wilson Barlow were talking about, it can be depression. It can also be irritability and anxiety, because irritability will sometimes come with anxiety. And so I think that's important to know. And then I think the other thing to think about is ADHD. We'll see a lot of kids in our practice who have ADHD, and ADHD will put kids at risk, at a higher risk for developing depression and anxiety. And it's kind of a natural thing to understand, right? Kids don't do well in school because they're trying really hard, but they keep having these failure experiences. Then kids will stop trying so they don't have those failure experiences, and they can say, well, I didn't try, so that's why I failed. And that can lead to thinking about themselves in a pretty negative way and lead to depression, and then avoidance and anxiety as well around school. So those are some of the other things I think to be on the lookout for.
Yeah, really helpful examples. Thank you. Something I see inpatient a lot is children who have come in with suicidal thoughts. So anytime a young person is expressing a wish, to die, to not be here anymore, those are all concerns we want you to take really seriously and have them evaluated by, a primary provider right away. Those are concerns that we really want to explore more. Are there any things that parents can do to kind of prevent mental health conditions in their children? Who would like to answer that? Radha?
Sure. I think that we teach skills in the program that I work in, skills to for all sorts of things, emotion regulation and distress tolerance and interpersonal relationship skills, mindfulness skills. And one of the skills that we teach the parents and the children in our program has to do with validation. So being able to talk to your child and listen to your child in such a way that they want to talk to you and they want to listen to you. And so there are some parenting resources that are out there. There's so many choices, right? So I think it can be kind of hard to know what's good and what's not. And some of the books that a colleague turned me on to when I was just starting out at uni actually are parenting books, and the title of the series is the How to Talk series. How to talk to your child so your child will listen, and listen so your child will talk. And they have a series for teens, and they have a sibling rivalry one actually too. And they're all really very accessible. A lot of them have little cartoons to kind of illustrate the types of typical interactions that parents will have with children, where there's an opportunity for a positive choice, where sometimes, we're so stressed out that we're not able to make that, but it's really helpful to see those examples laid out, because it helps you to feel better as a parent, right? Like, oh, I'm not the only one that has these situations and lose my temper, and I can show, oh, this is how I could do it, and this is another way to do it where my child might respond more favorably. Parenting manuals, I think, are highly underrated, and those are a couple of good ones, I think, to help the relationship.
So these are all things parents can do to really help a child before things escalate into a crisis situation.
Yeah.
So not only things that they can do to help build their relationship and open those lines of communication, but also to help it not get to that boiling point. Am I hearing that right?
Yeah.
Okay.
Yeah.
Great.
I'd like to add
Yes, Dr.
something.
Miller.
Something to think about too is, we're talking about prevention, and I also want to make sure there's biological history here. If your child, has a mental health problem, it doesn't mean you're a failure as a parent. It just, sometimes it happens. There's environmental stressors, there's biology that plays a huge role. So I think it's really important that we also recognize it is an illness. It is here, and we need to pay more attention to it and find better treatments for it and continue to address it so that kids and parents don't feel like it's something wrong with them if it's something that they have.
It's such a good point, because I do think parents so often feel a sense of shame that they could have and should have prevented something in a way. And really, you said that's not the case. And there are things we can do to kind of nurture the relationship and support our child to bounce back when things are stressful. But some things we just can't prevent. It sounds like, in general, we're talking with youth and about youth that most of these are treatable or at least manageable conditions, right? Like they have therapies that are evidence-based. They have medications that can be helpful. And so it's not like this necessarily would be a chronic condition. Is that right?
Right.
Okay. So we often see that young people, teens and children, kind of hide how they're feeling. And we've talked a little bit about communication strategies to open up dialogue with parents with the How to Talk series. Is there anything else you would recommend to help young people feel like they can talk to their parents? Dr. Wilson Barlow.
Yeah. Certainly there's a lot of resources and supports. I think that sometimes for parents, there's so many resources and ideas that it can be overwhelming. And I think that there's a huge benefit in just being present, being fully present with your child, especially in these times, in a pandemic environment where stress and anxiety and worry is present for everyone, including parents. And that's really, really important to acknowledge that and to see that it can affect all of us. So I think for parents, even if you are just playing a game or eating meals together, it doesn't necessarily have to be intensive conversations or deep discussions about mental health symptoms, but being there, having your child see you as a resource and somebody who cares and somebody who can be present is, I think, the very first step.
I love that. I've been noticing that during the pandemic, I'm less present at times with my kids. I come home, I'm a little tired, and I might check out on my screen and they're on their screens, and having, that reminder to reconnect with them and to really be present is such a good reminder. So thank you. So what can parents do to help their kids while they're waiting for professional help? So we're talking about, how to help your child bounce back from stress, but then what if they do need help and how to manage that? Because the wait list can be long. Who would like to take a shot at that question?
I'm happy to
Radha.
talk about that. Yeah. There's so much information out there, and it's a great thing because there's so much, and I really like to focus with parents on what's available electronically, because it's accessible, it's free, it's anywhere you have a phone, which is probably all the time everywhere with you, and so I've looked at apps and websites and YouTube as 3 resources for families. And I'll start with the apps with a caveat, which is that all of these apps are meant to be used with outpatient services in place for your child. So they're meant to be additions. And I'll mention them because as you're waiting and thinking about what will this be like to be in therapy, maybe for my child, what types of techniques will they use? These apps can be a source of information for you and will also help you to understand these are the types of maybe homework assignments that I might see that the therapist gives to our children, for between sessions, things that we'll work on so that we can get better at these skills. So the apps that I'll mention are all free. They're well studied, so they're evidence-based, and they have good privacy policies. They're all developed by the US Department of Veterans Affairs, and they were originally developed for veterans, but they are, many of them, usable for anyone who has the types of disorders or needs the type of help that the app offers. And so one of them is called Mindfulness Coach. And these are, I think, all available through Google Play and the App Store, the Apple App Store. AIMS, AIMS for anger management. CPT, C is in cat, P is in Peter, T is in Thomas Coach, which is for cognitive processing therapy. ACT Coach, ACT Coach, which is acceptance and commitment therapy, another evidence-based technique and theoretical perspective that therapists will use. CBT Coach, C as in cat, B as in baby, T as in Thomas, and PTSD Coach, PTSD as in post-traumatic stress disorder coach. Those are some great apps that you can check out. And then there's a website called DBT Self-Help. So D as in David, B as in boy, T as in Thomas, Self-Help. It's commercial now, it used to not be, but it has great information and very user-friendly access to the 4 sets of DBT skills. It has things like flashcards, and it's got a lot of stuff on there that I think can be helpful. And then the YouTube channel that I wanted to mention is called DBT-RU, so DBT-RU, and they're 5-minute little cartoons, basically. They're very cute and fun to watch, that can teach you the interpersonal, all the skills that the DBT techniques have to offer, and they're very accessible. So those are some ways you can kind of learn about the things that your child might start to experience and work on in therapy.
I love that. Okay, so you have a child, they're going to be seeing a therapist. Usually they had access to that therapist through a direct referral, like you found someone and you called them, you saw who your insurance covered. Maybe you saw your primary care doctor and they put in a referral. Maybe you saw a primary doctor and then they put you in with a psychiatrist and then they put you in a therapist. So lots of different pathways, but the therapist will be working with your child and you on specific ways of handling their feelings, their thoughts, and their emotions, right? So there are different therapies. So there's ACT, there's DBT therapy, and there's CBT therapy. So all the acronyms, right? But basically they're all different therapies that talk about how we feel and think and how to safely manage those big feelings or thoughts that could be scary in a way that doesn't hurt ourselves or other people. Is that right?
Absolutely.
So you can go ahead and get started on that with your child at home. And also, for most of us, we know when a child is waiting to see a provider, they're usually, struggling with big feelings, anger, irritability, or sadness, maybe a lot of worry, especially for younger kids. And so these are really great techniques that can help your child calm down in the moment. DBT is an awesome therapy we use a lot for young people that really focuses on like how to change your temperature, how to change your muscle, tension to feel better in the moment and calm down. So these are all great places to start. Yes, of course, Dr. Miller.
There's some other resources in the community that you might be able to access while you're waiting to see a provider too. One option is to talk to your child's school counselor to see if they have any groups at their school. Not all schools do, but that could be an option. And the school counselor could possibly also guide you in the direction of finding other resources. You can also get online and Google community groups for kids, because there are some out there. They tend to wax and wane, but there are some out there that can be good. And then there's also things like, depending on what your child is struggling with, if your child is struggling with like sexuality issues or gender issues, there's the Pride Center, there's Encircle. So there's other community groups. And I also think just talking to other parents, because you will need your own support, but there are also good resources.
Yeah, thank you for that. It's so good to know about free local resources. Dr. Wilson Barlow, you had your hand.
Yes. And just to underscore what Dr. Miller was already talking about, a huge protective factor or a component that can help along the recovery process for mental health challenges is a sense of connection, a sense of belongingness, a sense of being a part of a community. And that can be really any community. It's really that feeling of being connected and being a part of something bigger than oneself that can be really important.
I love that. We've talked about a lot today so far in kind of our second of three community discussions, today focusing on youth and how to get them support and services, how to help families support their children. Thank you to our audience. I'm starting to see some questions come in from Zoom, which are great. We're going to get to those. Keep them coming. We really want to answer things and help you. We want this to be relevant and practical, real life tips. So we've talked a little bit about how to talk so your kids will listen, how to listen so your kids will talk. We've talked about how to kind of look for some different apps or YouTube to help them while they're waiting for services. We've talked about maybe some of the signs and symptoms to look for, changes in their functioning, irritability, mood, thoughts of suicide. Those are all reasons and indicators that it's time to talk to your doctor, maybe get them in therapy. Why do you think the wait times right now are so long to get in to be seen? I mean, they're much longer, it seems to many, than before the pandemic. And why do we think that is? Dr. Miller?
Well, I mean, I just think the need is so great, right? I think people who were, struggling before the pandemic, we've got that group, and then we have this whole other group that we have seen because of the additional stressors that the pandemic has brought. And it's hard. It's really hard.
Yeah, the new normal is, foreign, right? Dr. Wilson Barlow.
I certainly agree with that. I think that there's an additional layer of the fact that mental health providers are humans too, who are living through the pandemic and who have been affected in their own way by everything that's been happening, and have maybe themselves had to take a little bit of a step back or a reevaluation of what kind of services they can provide, how often they can do that, et cetera. So in addition to the increased need, it certainly seems like there's a decreased supply of providers at some points.
Absolutely. I think something that people who may not be in the medical or healthcare system may not be aware of is when a provider is not taking new patients, it's because they have a certain amount of patients that they have committed to seeing regularly. Maybe that's every week for therapy, a couple times a week or every other week. But they're also committing to answering phone calls to that family, providing medication care, helping in emergencies. And so sometimes I hear people get really frustrated. And then when they understand that it's really that provider is committed already to, wanting to provide good quality care to those patients, that can help them a little bit. But we definitely have seen an unprecedented need for services. There's also the theory that a lot of people in the beginning of the pandemic who already had pre-existing mental health conditions, they didn't seek care because they were scared. I mean, it was a scary time. We didn't know if we should go to the doctors or not, if we should stay home, if we were going to get sick, if we talked to people. And so people may have gone without care for longer. And then when they sought care, their symptoms had gotten so much worse.
Mm-hmm.
So in addition to all the normal stresses that have happened in the pandemic and the uncertainty and the anxiety, changes in employment, changes in childcare has been a huge deal for a lot of people. We've seen kind of an exacerbation of people who've already had conditions. So what do you think a parent or caregiver, where should they start? Where should they start when they're looking for treatment? So, the same day crisis clinic, should they call the Safe UT or use the Safe UT app, the crisis line? Kind of when do people do that? When do they go to inpatient? When do they go to outpatient? Where do we start? We all look to each other.
Yeah,
Because this is such a
let's
good
just
question. We
start,
get this
yeah.
all the time, right? Like, how do we determine what level of care a child needs? Radha.
Yeah, I think there's no bad answer to that question. Reach out for help. Whoever you think you should reach out to that person. And that can be a provider, that could be the Safe UT app, or that could be a crisis line. All of those people and services are designed to be a big welcoming arms, right? So those are services and providers who are used to seeing a wide variety of issues and problems, and they are trained and they keep informed about the various avenues of where to direct people to get the type of help that they need in particular. There's not a bad a bad answer to that question. But your primary care provider is a great place to start. Your child's pediatrician is a great place to start. A teacher in a school, if you have a good relationship with that person, that's a great place to start. If you've heard about another family who might be struggling in the community and maybe they got some help, that's a great place to start. You know, information is out there and it's online. Certainly, if you just Google Safe UT, it will direct you to a myriad of services. And all of the major health provider systems in our area have mental health services and are connected to one another. And so there's really just do it. Just reach out for the help, and it will get easier once you do that.
You know, while we're talking about it, let's talk a little bit about the Safe UT app and what that is. And, you know, who can speak to that? I will.
Okay.
So the
Go for it.
Safe UT app is a free app that is available to all children, youth, adults in certain categories in the state. And so you can download it, and it is a confidential, easily accessible app that you can talk directly with a professional, so a mental health professional. So 24/7, it's available, it's free, your child can text. You want to definitely download it and create a username and a password so that you're all ready to go before the crisis hits, because so many of the times, like, that's a hard thing to do when you're in crisis. So that is an app. We have that app. We just rolled out one for college students specifically here at the U. So there's lots of really great individuals that can be served by that app.
Well, and you know, if you are not at a point, or if your child is not sort of openly talking to you about these things, but you're worried, you know, put it on their phone and say, hey, I heard about this new app. And if you feel like you're having a crisis or something's going on, or you're worried about a friend, because a lot of them are worried about their friends who have made suicidal comments, they can just text. So I think even if you're not at that place, it's a good thing to just introduce to your child.
I love it. And there's education in the schools that this is a free resource. So a lot of the children in, you know, your children may actually know about it, and you may not know they know. There's also a 24/7 crisis line that you can access that has a licensed professional that's there on the phone ready to help. We also have a warm line, which is kind of like a crisis line, but it's for less acute need or less emergent needs. Really, it's more for, you just need an encouraging voice. You need some, you know, kindness in your day. That's a really great resource. We also at HMHI have a 24/7 crisis assessment center where you can call and make an appointment to have your child or youth seen. Or you can just even walk in. There's also kind of a mobile crisis team that will actually come to your house. And Dr. Miller, do you use that much in day treatment?
We do. It's called MCOT, and it's a mobile crisis outreach team. And they can go, if there is a crisis happening in a family, they can go and assist. Now, they can't transport, but if it is an emergency and the child needs to go to the hospital or someone does, then the police can be called to help facilitate getting an ambulance or whatnot. There is another crisis team in the community called SMR, which is also specifically for youth, that provides a very similar service. And I think they also can connect you to services, sort of crisis services, until you can get hooked into a regular provider. So there are things out there.
Yeah, that's
Definitely.
great. Yeah, Dr. Wilson Barlow.
I think it's also important to talk about the role that inpatient psychiatric services plays. That's a big part of what we do here in the hospital. And essentially, you know, if a child or an adult cannot be safe in their home, in their community, they come here for a brief period of time. And I think that's important to highlight, that we certainly don't want to keep people, you know, inpatient for an extended period of time, but we're able to provide really intensive psychiatry, psychology, social work, group therapy, and support services in an environment that many people, I don't know about you guys, but much of the feedback that I've gotten is that coming here isn't what people expect from a psychiatric hospital, that it's much warmer, it's much more inviting, it's much more kind of lively and engaging than I think what a lot of times the media a little bit kind of tells, shows it to be. So we are certainly in the business of, taking people who, again, can't be safe in their home or in their community and providing really intense kind of rehabilitation to get them back out as soon as possible.
Thank you, Dr. Wilson Barlow. I love that. So I'm an inpatient child psychiatrist, and Dr. Wilson Barlow and I work together on. So if a youth comes into the hospital, I see them. I try to help assess and diagnose what's going on, and then we can prescribe a treatment, which often is therapy. So they will meet with a therapist typically 4 times a week, and they'll see a psychiatrist, so a medical doctor who can prescribe medications. They'll see them 6 out of 7 days, 7 out of 7 if needed. So that's really fast help, and really in that short time frame, we can really get your child feeling better. We can come up with a safety plan for you and your family, and we can help you then with that next step of what do you do when you leave the hospital? Who do you see? Outpatient? Do you go to day treatment, where it's kind of an intermediate, where your child goes during the day for that program, to kind of during school hours, and then goes home at night, and then the next day kind of gets feedback from the team, and from you give feedback to the team about how things went. So there's all different levels of care. And here at Huntsman, we can really treat anything, any mental health conditions your children may have. So eating disorders, mood disorders, bipolar disorder, major depressive disorder, anxiety disorders, kind of behavioral disorders. So when we think of like ADHD, lots of disruptive mood dysregulation, all of those conditions, we have professionals that are licensed and ready and trained in evidence-based therapies to help you really be successful at home. So we're starting to see more Zoom questions come in. I'd like to kind of move to the Zoom portion of our discussion. And I love that you brought up social media, Dr. Wilson Barlow, because that is a question that is on from our Zoom audience. So specifically at young ages, we know that youth are accessing social media, right? And the age of getting a phone is getting younger and younger. And so what are recommended boundaries regarding this? What advice can we give parents? Yes, Dr. Wilson Barlow.
Yeah, it's a great question. And it's a topic that comes up all the time in work with families, children, adolescents, certainly. And generally speaking, what we want to do is create balance. So is there a role for social media in the lives of many adolescents? Yeah, I think that there could be an argument for that, definitely. But when that gets off balance, when somebody is using social media at the expense of also seeing friends, of also exercising regularly, of also engaging in activities that are important to them, what we call values-based activities, that's when it gets really problematic. So can it be an element of, a typical adolescent life? Certainly it can, but it has to be just an element.
I love that. I feel like you can use that example for anything, right? Like video games, screen time, social media. When is it getting in the way of all their other, balanced activities? If it's becoming their only thing, maybe it's time to kind of shift some of that.
And sleep.
Yeah.
How
sleep.
often do we see kids who stay up all night, so things like, setting parental guards, not shutting down the internet service at a certain hour, actually physically taking the phone in the evening times. Those are all strategies that we utilize and encourage parents to utilize.
I love that. Do you ever recommend that families kind of follow along on their child's Instagram, or kind of befriend them, or look at their phones even for text conversations? What kind of rules, do we recommend? Radha?
Okay.
Oh, Dr. Wilson.
Yes, absolutely. Absolutely. And I think that the frequency and the intensity with which we follow our children is variable depending on the particular child and whatnot. But it's what we would recommend. What I would recommend is definitely checking periodically and not having that be at the same day, the same time, having it be quite variable in terms of when you do it, how often you do it, because kids are smart and they pick up on things.
Yeah, I love that. They are. I mean, I think, yeah, Dr. Miller.
I was just going to add, and I think it's important to tell them when they have a phone that this is the expectation of what you're going to do. It's not a sneak attack. I mean, sometimes it might be, but the goal is for them to really know, hey, we purchased this, or even if they purchased it, they are in your home. There are certain rules about electronics, and this is one of them.
I love that. This is it. And let's say your child already has a phone or a computer and you're just hearing this now. Would it be okay to go back and set some rules or kind of guidelines around it?
Absolutely. Absolutely. It is okay.
Yep. You're the parent and you
Yep.
can always kind of change, the rules, to be honest. I mean, you can and definitely want to provide your child some explanation for that, but you can say, look, I didn't realize, it's a different world than when I was growing up. And I really want to keep better, pay better attention just to make sure you're safe and that I can help coach you when these difficult conversations and scenarios come up, because I would sure hate for you to get involved in something and we didn't talk about it. I didn't help you. I didn't coach you.
Well,
Yeah, Dr. Miller.
And you can validate if they're frustrated, which they will be. You can totally validate that, and that, yeah, this is sudden and you weren't expecting this. And it's still my job to keep you safe as a parent. Both things can be true.
I love this. This is real-time advice. Send in your questions. We've got you. Okay. So one question from our audience was that, what are some of the most common suggestions given to youth as part of their treatment programs? This is an interesting question because the response may be varied depending upon if they were an inpatient or if they were in outpatient, day treatment. But what would you think? I know for sure, from inpatient, when we give youth a lot of education about managing their strong feelings, how to calm themselves down, how to be safe, how to make sure that their home environment is safe. And so they don't have access to use things if they're feeling really overwhelmed and impulsive and have desire to hurt themselves or someone else. I know those are some of the things that we definitely go over. But what would you think, Dr. Wilson Barlow?
Yeah, I certainly agree with that. I think that one suggestion that spans across a variety of evidence-based interventions is kind of this idea around engagement or activity. So being diligent about how we spend our time, given the fact that so many hours, especially for our children and our teens, can go by watching TV, playing video games, being on social media, which is, again, an element of that is okay. But it's also important to be doing things that give you a sense of purpose, that give you a sense of accomplishment. And depending on the particular need of the child, sometimes it's very relevant and very important to be pushing that child a little bit outside of their comfort zone in a way that is tolerable for them, especially if their maybe world has gotten quite small because of anxieties and fears and withdrawal in a lot of ways. It's important to grow that for that child and slowly expand that world. So I think generally speaking, kind of like behaviors and the way we use our time is something really important to be thinking about.
I love this. Dr. Miller.
I would add, because I think that is a big piece of it, is also they are learning a lot about hygiene, like sleep hygiene, how that is a huge contributor to mental health issues, so trying to take care of yourself, like Dr. Barlow said. And then the other things that we're really focusing on with them are the behavioral emotional regulation skills. How do you manage your anxiety? How do you manage those intense feelings? Whether that's like progressive muscle relaxation or kind of paced breathing. So there's a whole range of skills that they're learning. And then also learning, identifying who can you go to for support? When do you need to tell someone that you need help? When are you having suicidal thoughts? Who do you go to? How do you cope if you're having self-harm urges? Those are all things that we're directly talking about with teens, with youth.
I like that. Dr. Miller, would you say a little bit more about sleep hygiene? Like, what that means? That word hygiene always confused me for a while.
Yeah, it's really, the structure, it's sort of the nature around sleep, how sleep occurs, right? It's when you take a drink glass before you go to bed. It could be when you eat. It's sort of setting the structure of how you can best optimize your sleep. Going to bed at the same time every night, even on weekends, as much as you can. Obviously, that's going to be hard with kids. Doing things that increase the chances of good sleep, which is like no screen time, half an hour to an hour before bed, because the light can be disruptive. Not doing, activating activities right before bed, maybe helping your teen find kind of relaxing and calming things to do before bed, whether that be like taking a bath or reading a book or listening to calming music. And I think that's things as parents or as adults, we all need to practice as well.
Totally. So it's kind of like when our children were little, and we had to do a sleep routine or kind of pattern. We want young people to still do that. They may have gotten out of the habit. We may have gotten out of the habit, but having a routine or kind of a ritual at night to tell your body it's time to go to bed, and then to follow through with that and be consistent. So helping your child not have a TV in the room or take away their iPad or their phone, even though they're like, oh, I want it for my alarm, maybe buy your child an alarm clock. My children tried that one. I got on them with the alarm clock. So
I need my music.
Yes, right.
Well, we used to not have,
Old fashioned. Do you think, so one question from the audience is that they have been seeing a lot of youth end up in the pediatric ER, and their question was really helpful. Does HMHI coordinate with places like Primary Children's, do you think, to help kind of, reduce the amount of children that are there waiting? Radha.
Yes, we do. Yes, we do. Yes, Primary Children's and HMHI's Clinical Assessment Center and Intake service is coordinating on an hour-to-hour basis, basically every day of the year. Primary Children's is where families take their children when they are having an emergency of any kind, including a behavioral health emergency. And Primary Children's is largely where the children who end up in the inpatient units of HMHI and I think other organizations throughout the Valley, that's where the children are starting out. And they have great clinicians in Primary Children's. They have behavioral health specialists, social workers, physicians, nurses. They have crisis services there. It's a wonderful place to bring your child if you're in doubt about where to bring your child.
Yeah, I love that. We work really closely with all the hospitals in the area too, Davis Hospital, Intermountain, just to help with children so they can get into Huntsman mental health, whether that be through our inpatient or day treatment. We often do, have youth come into the assessment center needing an intermediate program like day treatment. And it's really nice when your child is in a day treatment program, if they do have a need for what we call a higher level of care or to go inpatient, we can easily do that here at Huntsman. We have all levels of care. So we have inpatient, which is the most, protective level of care. We've got the intermediate level, which is highly used and vital to children's well-being. And then we have the outpatient where you can see a provider. So we can do it all. Thank you, everyone, for coming today. This has been an awesome conversation about how to help youth, how to help navigate this somewhat complex medical system. Hopefully it feels less complex now. Hopefully, we've given you some tips, some tools, some books. We've talked about apps, the free Safe UT app, the crisis line. All of these resources are available on our website. We want to thank you for coming, audience, to the second of 3 community conversations here at Huntsman Mental Health Institute. We have May 19th. You're going to want to RSVP for this one virtually. This is a virtual event. May 19th, 6 to 7:30 p.m. We are going to have our third community conversation. The topic is healing out loud, unmasking mental health stigma. So we're going to really unpack that stigma. This is going to be a fantastic event. So this is where we reveal the winners of our Healing Out Loud social media. I don't know if you follow Huntsman on Instagram and Facebook, but we were posting some of these videos and they were amazing. So our young people participated in a social media video contest, and we're going to talk actually to a panel of young people about how they manage their own mental health. So these are really brave young people who have come forth. They're going to talk about their own mental health, struggles that they've had and how they've conquered things, and how they've been impacted by the stigma that's out there that hopefully we start to see lessening. I mean, that's something in the pandemic I've definitely seen, is that more people recognize it's okay to not be okay, and they're seeking help. So you definitely want to come when I attend that. You can RSVP at the link in the chat. And again, that's May 19th from 6 to 7:30. The topic is healing out loud, and that is the third of our 3 community conversations. Thank you again to our wonderful panelists. Thank you for coming today. Thank you for spending time. Thank you for all you do for our youth.